Now we are moving forward to the more practical session where we are actually dealing with the patient in question. And this is obviously a brown 10-year-old gelding. He's a pleasure horse, and I know him from a former consultation. And today we are going to perform a routine float job on this patient. And as I've stated before, I always start by listening to his heart and his lungs and his windpipe here in order to actually check that his health is in a state so he can manage the sedation which will follow after this preliminary examination. So now I'm listening to his heart. He has definitely a healthy heart sound. No problems here on the left side. And then again, I'm simply moving the stethoscope to a nice overall and all-round place to listen to his respiration. No problems here on the left side. Actually, a horse's heart is a very, very big muscle, and it's very easy to listen to his heart sound also on the right side. And also here I can confirm that the horse's heart is sound and healthy. No problems there. Again, moving the stethoscope up to the right side of the horse and listening to his respiration. He's curious now. Nice, no problems there. It's very, very easy to listen to the airflow going through this big windpipe without any obstructions. There's no signs of illness here. That's a standard procedure in our practice to listen to the very important circulatory organs. And finally, we will palpate his lymph nodes. His regional lymph nodes expresses eventual disease conditions in the head region, which is, of course, where the mouth is. So he has no swelling of his lymph nodes here on the submandibular place. He seems nice and healthy and sound to proceed with this oral exam. So now he's definitely fit for sedation. After the IV injection has taken place, we are using these minutes to start our journal or our clinical file up here. We can take down some client data, of course, and some horse data. Now I know this horse from a previous consultation, so there's no problem in that. He's already registered in our computerized system back home. But this is a routine job, and we know of him and the owner, of course, from previously examinations. So we often use this lack of time while the sedation is taking effect to fill out our clinical sheets. Seldomly the horse gets so affected that he's swinging, but he might. It's extremely seldom that the horses gets bad or even fall. It's extremely seldom, as I said before. But of course it can take place, and therefore it's very important that you are situated in a place where there's no objectives so who can harm the horse should he fall. Okay, now we're moving forward to the more practical session of today's work with this horse, who has been introduced, and we're always starting off by rinsing his mouth. That's very, very important, very simple but very important act, because horses do always have quite a slimy saliva and mixed up with a lot of badly chewed hay stuff and so on. So we got to rinse the mouth, add it with a little detergent and some soap to dissolve this slimy saliva. I always rinse one side at a time using this dose syringe. He's a very friendly horse. This also leaves the possibility that we can check the reflux water here to see if there's anything that might indicate pathology in this horse's mouth, and there's definitely not. It's almost pure, only containing a little soap, contains residues from saliva and no feedstuff. There's no blood and there's no foul odor inside this bucket. So that indicates that we are dealing with a normal and healthy mouth. And we always remove the horse's holder totally from the head. He doesn't need it. He's sedated, he's calm, he's easy and has a nice situation due to the drugs. Then we are placing this mouth gag over his neck, and I stick my finger into the side of his mouth and pricks him a little in the palate, which makes him to open his mouth. And we always check that the soft tissue, the lips and the tongue is not stuck inside this apparatus. I think one more hole, yes, exactly. And there we are. We can click this McPherson type full mouth speculum open. You can see he has a very, very powerful chewing muscle, and it's not very healthy for you to stick in your hands before you're quite sure that this mouth gag is actually placed correctly. Seems to be now, and we can always click it up to 3 steps, and again check that his soft tissue, lips and tongue is not stuck. Seems to be okay. And then we can place his head on this headrest. It has a soft lining here. There we are. Again, check that the tongue is free, moving freely. And I use this light source in order to illuminate the oral cavity. And by the first primarily visual inspection here, I can check that, as I expected, this horse's mouth has been checked previously by myself. There is no any indication that there has been something badly going on meanwhile. His arcades, which is this long row of teeth consisting of 6 individual cheek teeth that is very, very closely together, is situated perfectly in his mouth. His mucosal lining, both in the palate and inside his lips and his cheeks and his tongue, is working perfectly. Again, no foul odor outside the mouth. After this brief visual inspection, I can palpate with my fingertips all the individual teeth all the way back to the last cheek tooth in the upper arcade in one side, and then I flip over to the other side while I slide back forwards here and can feel a slight tendency of sharp enamel points, which is a natural development through this year where I haven't been consultating this horse. He has no obvious problems in his upper arcades, and then I can turn my hand, and again, on the background of my previously visual inspection, I can palpate the back of his most far cheek tooth in the lower arcade. I can feel it very clearly, and then tooth by tooth, feeling if there is any problems besides the expected sharp enamel points. There is not. And if I had suspected a problem with a cheek tooth during to foul odor or something palpatory that is not supposed to be there, I would of course use my dental mirror to stick into the mouth to really visually inspect if there is any problem. So a dental mirror is a very, very good instrument to use on a daily basis. We are just concentrating on the cheek teeth, which has to be power floated. And what is actually going on, and this is a very, very important point of view, is that you don't have to take very much material out the mouth. I can demonstrate what is going on by using this cranium. And actually, it's not the meaning that these teeth, who are very coarse in their feeling, has to be floated down and be as smooth as possible. Not at all. It's only the sharp enamel points on the outside of the upper arcade and on the inside on the lower arcade that has to be touched by this mechanical instrument. So what is actually going on when I'm floating this horse with this power tool is that I'm leading this instrument inside the mouth, and I support it with my left hand since I'm right-handed, and I place this rotating disc, you can see the rotate right there, on the back of the most far away cheek tooth on the upper arcade, and then I slide back forwards and I rip off all these sharp enamel points and not touching the chewing surface, which has to grind the food later on at his next meal actually. So only the sharp enamel points here, and of course eventually if there are any dental overgrowth or any other dental problems in here, I can use this rotating disc as a very, very effective and quick functioning mean of reducing dental overgrowth and remove these sharp enamel points. So don't leave a very smooth and nice mouth, even though it's possible by these power tools. It's very, very important to state that it's only the pathological things that has to be removed. Now we have finished up our job doing his upper arcades and his lower arcades as far as the cheek teeth is. Now we are left here with a naked horse head where we can visualize the incisors very, very clearly. And we can see that they are pretty good aligned. There's a very straight line between his upper mouth and his lower jaw, upper jaw and lower jaw here. The line between these two sets of teeth are very, very straight and fine. And what we also can see is when we lift the horse's head, he actually creates a little overbite or a so-called overjet. And that is actually all horses that will produce a sign like this. Because if we lower his head down to a more neutral, balanced position where his forehead and his nose is in a straight line, we can see that the teeth has actually changed their position quite a lot and is now, he's using his tongue for a little bit. He's drying his mouth. We know that from our own dentist. Now he's finished. We can see now they are perfectly aligned in a normal, neutral position. And that can make us go further on with a bow of his head, actually illustrating a situation where the horse is in a dressage situation, and this will create a slight but nevertheless there underbite. If he had a dental overgrowth, typically on the first cheek tooth in the upper arcades and on the last cheek tooth on the lower arcade, he will have a biomechanical problem of getting this underjaw to slide normally, because the overgrowth will stop this natural moving forward of the underjaw, and that can create, in a lot of cases for dressage horses like him, a vast riding problem for the cooperation between the horse and the rider. So you very often encounter problems like this, and even small changes means a lot for more sensible types of horses, which typically is the case among the high-yielding dressage horses. So even little ramps and little hooks and formations like that means quite a lot and has to be checked and corrected if they are there, which means a great possibility for a great performance increasement on the sports arenas. Having said this, checking the incisors for tartar, that's dental buildup of concrete and little elements, is very, very important to get rinsed from consultation to consultation, because or else it will build up from year to year. And we also do have problems with a lot of tartar accumulation on the incisors, and especially on the canines here at the side. One can see very clearly if we have a normally shut mouth like this situation and we move the lips backwards, you can, as a viewer, see how much the tongue actually takes up space inside the foremouth of the horse. which means that problems with the canines, that is sharp and pointed canines, might create some problems by sticking from the underside here and the basement of the tongue, and again from the upper side, from the upper jaw here. So we gotta smoothen these canines, not to remove them, not at all, but just to smoothen them so that the bit, which is actually situated right here, actually takes up space inside the mouth and can provoke the tongue to slide on very sharp and pointed canines. They have to be reduced and rounded so they are nice to touch, because are they nice to touch for my fingers, it's always also nice to have inside for the horse in his mouth. So checking up incisors, and for the males, also checking the canines is a very, very important part of a routine dental job on a horse. Now, as we have finished up the floating procedure, we're gonna end by rinsing his mouth, because he has a lot of debris and dust which has been produced by these mechanical instruments. And it's just to make sure that he's comfortable with this procedure, again, because we're gonna see him again in a 12-month time. His age and the fact that he has been treated well also a year ago and now makes me very certain that he has no need for a routine dental job before in 1 year's time. Of course, if something happened in his life, he's traumatized or something is happening, the owner is always welcome to contact us. And of course, we can, on a more acute basis, make a consultation and check up the teeth again if something has happened. We're gonna rinse him again in the other side. And then at the end, make sure that he's not eating for the next hour and a half, because his sedative condition is not very good for his coordination of food uptake and swallowing process. So make sure that the horse is placed in an empty box, or if he's going inside his own box with a straw dressing or food stuff eventually in his crib, whatever, it's very, very important that he's muzzled with this mouth gag or mouth muzzle, so he won't be able to take up food for the next hour and a half.